Can frequent masturbation really benefit the prostate in older men? This is a question many men wonder about but may feel uncomfortable asking. As men get older, the prostate naturally gets larger, which can lead to various health issues. Understanding how sexual activity affects prostate health becomes increasingly important, especially since prostate problems are so common in older men. Let's take an honest look at what happens to an older man's prostate when he masturbates regularly. Regular ejaculation, whether through sex with a partner or masturbation, may help keep the prostate healthier as men age. When a man ejaculates, fluid moves through the prostate gland. This movement helps flush out harmful substances that might otherwise stay in the prostate and cause irritation. Think of it like running water through pipes regularly to keep them clean and working properly. Several major health studies have found that men who ejaculate more frequently may have a lower risk of prostate cancer. One large study showed that men who ejaculated 21 or more times per month had about a 20% lower chance of getting prostate cancer compared to men who ejaculated only 4 to 7 times per month. This benefit appeared to continue as men got older. The prostate is filled with tiny fluid-producing glands. When these fluids aren't released regularly, they can become thicker and trap unwanted substances. Regular ejaculation helps clear out these fluids, potentially reducing swelling and pressure in the prostate. This may help explain why frequent ejaculation seems linked to better prostate health. Besides potentially lowering cancer risk, regular ejaculation might help with other common prostate problems. Many older men deal with a condition called benign prostatic hyperplasia, which simply means an enlarged prostate that isn't cancerous. This enlargement can press on the urethra, the tube urine passes through, making it harder to urinate. Some doctors believe that regular ejaculation may help reduce some symptoms of this condition by decreasing swelling and pressure. Additionally, masturbation can increase blood flow to the genital area, which may help keep tissues healthy with good oxygen supply. Healthy tissue function might make the prostate less likely to develop problems over time. Beyond the physical benefits to the prostate, regular masturbation offers several other health advantages. For many men, it works as a natural way to reduce stress and tension. During sexual activity, the brain releases feel-good chemicals like endorphins and dopamine. These chemicals help lower stress and can improve mood. Many older men find that masturbation helps them sleep better too. After ejaculation, the body often enters a relaxed state that makes falling asleep easier. Some research suggests that regular ejaculation might help maintain sexual function as men age. Just like other parts of the body, the sexual organs benefit from regular use. The saying, "use it or lose it," applies here. Regular sexual activity helps keep blood flowing to the genital area and may help maintain better erections over time. Have you noticed how much better you feel after a good stretch when muscles haven't been used for a while? The prostate works similarly. Regular ejaculation exercises the muscles involved in sexual function and helps keep everything working properly. This includes the pelvic floor muscles, which play an important role in both sexual health and bladder control, two areas that many older men worry about. Despite these potential benefits, there are several common myths about masturbation that cause unnecessary worry. One widespread misconception is that masturbation causes erectile problems. The truth is that moderate masturbation doesn't cause erectile difficulties. In fact, it might help maintain better sexual function by keeping blood flowing to the area. However, very frequent masturbation in a single day might temporarily make it harder to get an erection, simply due to the recovery time the body needs. Another common myth is that masturbation lowers testosterone levels. Research doesn't support this belief. Short-term studies show that abstaining from ejaculation for about a week might cause a small spike in testosterone, but regular masturbation doesn't significantly lower overall testosterone levels in the long run. Some men worry that masturbation will make the prostate problem worse if they already have issues. For most men with mild prostate problems, moderate masturbation is perfectly fine and might even help relieve pressure. However, if ejaculation causes pain or discomfort, that's a different story and worth talking to a doctor about. Many also believe that older men naturally lose interest in sexual activity. While sexual response may change with age, the desire for sexual pleasure remains throughout life for most men. Regular sexual activity, including masturbation, is a normal and healthy part of aging. While masturbation offers several health benefits, it's also important to understand the potential mental and emotional effects, especially for older men. The relationship between masturbation and mental health can be complex. For some men, masturbation provides a healthy outlet for sexual expression and stress relief. It can boost mood, help with sleep, and give a sense of physical well-being. However, how a man thinks about masturbation matters just as much as the act itself. If masturbation is seen as shameful or becomes a source of guilt, these negative feelings can cancel out the potential benefits. Cultural background, religious beliefs, and personal values all play a role in how men feel about masturbation. Having a balanced, shame-free view of self-pleasure is important for overall well-being. For older men in relationships, masturbation can sometimes become a point of tension. Partners might feel rejected or worried if they notice an increase in solo sexual activity. Open and honest talk about sexual needs can help avoid misunderstandings. It's worth noting that masturbation and partner sex serve different purposes. One doesn't necessarily replace the other. How often is too often? This is a question many men ask. There's no magic number that works for everyone. Masturbation becomes a problem when it starts to interfere with daily life, relationships, or work. If a man finds himself turning down social activities, missing work, or choosing masturbation over spending time with loved ones, it might be time to think about cutting back. The type of material used during masturbation can also affect mental health. Some research suggests that heavy use of certain types of adult material might change how the brain responds to sexual stimulation over time. This could potentially make real-life sexual situations less exciting. For older men already dealing with age-related changes in sexual function, this is something to keep in mind. Do you want more health advice like this? Hit subscribe, and let's optimize your health together. What about the idea of saving sexual energy? Some men practice limiting ejaculation to build up energy for other areas of life. This concept, sometimes called sexual energy conservation, has roots in several ancient practices. While scientific evidence for these benefits is limited, many men report feeling more focused, energetic, and motivated when they balance their sexual release with periods of abstinence. For older men dealing with certain health conditions, finding this balance becomes even more important. Heart problems, high blood pressure, diabetes, and prostate issues can all affect sexual function and might require some adjustments to sexual habits. These conditions don't mean an end to sexual pleasure, but they might mean thinking more carefully about frequency and intensity. Speaking of health conditions, there are certain situations where men should be extra careful about masturbation habits. This is especially true for men with specific prostate or urinary tract problems. For instance, men with prostatitis, which is swelling and inflammation of the prostate gland, might find that ejaculation either helps relieve symptoms or makes them worse. This varies from person to person. Paying attention to how your body responds is key. Men who have recently had prostate surgery should follow their doctor's advice about when it's safe to resume sexual activity, including masturbation. Typically, doctors recommend waiting several weeks after surgery before ejaculating to allow proper healing. Rushing this process could lead to complications or delayed recovery. For men with severe enlarged prostate issues who experience pain during ejaculation, masturbation might temporarily increase discomfort. In these cases, treating the underlying prostate problem should be the first priority. Once symptoms improve, normal sexual activity can usually be resumed without problems. Men taking certain medications should also be aware of how these drugs might affect sexual function. Some blood pressure medications, antidepressants, and other common prescriptions can impact libido or make it harder to reach orgasm. This doesn't mean masturbation should be avoided, but it might require more patience or different techniques. What about heart health? Many older men worry about whether sexual activity is safe if they have heart problems. For most men with stable heart conditions who can handle moderate physical activity, like climbing 2 flights of stairs without chest pain or severe shortness of breath, masturbation is generally safe. However, anyone who experiences chest pain, severe shortness of breath, or irregular heartbeats during sexual activity should stop and talk to their doctor. Diabetes can affect sexual function in several ways, including nerve damage that reduces sensation. Men with diabetes might need to be extra careful about how they masturbate to avoid injury to less sensitive areas. Using plenty of lubrication and avoiding rough handling becomes more important. Do you know how dehydration affects sexual health? Staying well hydrated is actually important for prostate health and sexual function. Dehydration can concentrate urine and potentially irritate the prostate. It can also make semen thicker and reduce its volume, which might make ejaculation less comfortable. Drinking plenty of water throughout the day helps maintain proper prostate function. The timing of masturbation can matter too. Some men find that masturbating right before bed helps them sleep better, while others might feel more energized afterward. Paying attention to how timing affects you personally can help you make choices that fit best with your daily routine and energy levels. Diet and overall lifestyle choices play a big role in prostate health too. Some foods seem to help the prostate stay healthy, including tomatoes, berries, fatty fish, nuts, and green leafy vegetables. These foods contain substances that fight inflammation and help protect cells from damage. Eating these regularly, along with staying active and maintaining a healthy weight, creates a good foundation for prostate health. Exercise deserves special mention because it helps with blood flow throughout the body, including to the prostate and genital area. Better blood flow means better delivery of oxygen and nutrients to all tissues, which helps them stay healthy. Even a daily walk can make a difference in overall health and sexual function. The combination of good diet, regular exercise, and healthy sexual activity creates a powerful trio for supporting prostate health. For men who want to improve their prostate health while enjoying the benefits of regular ejaculation, finding the right balance is key. This means not going to extremes in either direction. Neither avoiding sexual release entirely, nor masturbating so frequently that it causes physical discomfort or interferes with daily life. For most men, moderate sexual activity that feels comfortable and satisfying is the sweet spot. Regular checkups are an essential part of maintaining prostate health, especially for men over 50. These checkups can catch potential problems early when they're easier to treat. Don't skip these important appointments, even if everything seems fine. Many prostate problems develop slowly and without obvious symptoms at first. If masturbation causes any pain, burning, blood in urine or semen, or other unusual symptoms, seeing a doctor promptly is important. These symptoms could signal an infection, inflammation, or other condition that needs treatment. There's no need to feel embarrassed about discussing these issues with healthcare providers. They're medical professionals who deal with these concerns regularly. For men who live with partners, keeping lines of communication open about sexual needs and habits helps maintain a healthy relationship. This includes talking openly about masturbation if it's affecting the relationship in any way. Many couples find that understanding each other's needs leads to better intimacy overall. The bottom line is that moderate masturbation appears to be good for prostate health in most older men. It helps flush the prostate, keeps blood flowing to the area, and might lower cancer risk. Combined with a healthy lifestyle, regular checkups, and prompt attention to any unusual symptoms, it can be part of an overall approach to staying healthy as the years go by. Making informed choices about sexual health is an important part of taking control of overall well-being. Your experience matters. Please leave a comment to share your story or ask me a question. Thanks for watching.